Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. A cancer diagnosis is like an alarm bell with questions and fears ringing inside a patient's head. People want answers and treatment fast. But thankfully, patients at the University of Kansas Cancer Center have allies in the form of nurse navigators. Nurse navigators are usually the first voice someone hears when calling the cancer center. But they are much, much more than a comforting voice on the other end of the phone. Sometimes they're like a liaison. Sometimes more like a case manager, and they are always there to help patients understand the complexities of oncology care. Today, we are learning more about the many hats these nurse navigators wear and what you can expect if you ever need to call them yourselves. I'm joined today by three nurse navigators. Terry Bandman is right here next to me. She's the Director of Nurse Navigation at the University of Kansas Cancer Center. Good to have you.
Good morning.
She works with Rhonda Westerheide and Sarah Grigory. So good morning, ladies. Good to have you. And also, please welcome back Jason Spreitzer. He was on one of our previous programs where we learned about your treatment for oral cancer, and we are always happy to share that great news that you're 5 years cancer-free. How you doing today?
Good. Wearing my pin, and I'm just proud to be here.
Well, good. We're good. So glad to have you back to kind of talk about your relationship and how nurse navigation helped you from day one. So we'll hear about that in a moment. But Terry, let's just start by kind of explaining the job duties of a nurse navigator, because when we think of nurse, we usually think of somebody who walks us back to the room and takes our blood pressure at a doctor's visit, or maybe somebody who's administering medication at a bedside. We kind of have that picture in our head, but that's not what nurse navigators do. How do you explain the role so people understand?
Yeah, excuse me. A nurse navigator is a nursing expert in a particular type of cancer diagnosis or disease group of cancers. And what we do is we're there to help decrease that time from I have a problem that may be cancer, or I've been diagnosed with cancer, to now I have a treatment plan and now I'm starting on my treatment. And so what that looks like is when a patient is referred to the University of Kansas Hospital Cancer Center, they're connected to a nurse navigator. The navigator talks to the patient on the phone and collects a story. Tell me what's happened up till now. What have you had done? What imaging have you had done? Any biopsies? Maybe even treatment before. And then we can determine, based on that assessment that we do on the phone, what are the next steps for the patient? What physicians do they need to see? What additional testing maybe needs to be done and coordinated along with those provider visits. And our goal is when the patient comes in, they have this coordinated care with the multiple providers they may need to see, testing, so when they leave that visit, they have a plan in
It's
place.
like a package. It's all packaged up for them. And I love the word navigator because that's a word we use a lot. How am I going to navigate this going on in my life? How am I going to navigate this road ahead? So to know that you have somebody there to really lay out the plan and kind of relieve that burden. Why is it so in particular, why is it so important with oncology care?
Yeah. Oncology is such a complex disease. There's multiple different specialties that are involved in the care of a cancer patient. A medical oncologist who would prescribe the chemotherapy or immunotherapy, a surgeon, a radiation oncologist, and then even other specialties like pulmonary, GI, things like that. So, when a patient is told you've got a mass or you've got a new diagnosis of cancer, they have no clue what is the next steps for them. And so when they call us, we can then say, tell us your story, let's figure this out, and I'm going to guide you. I'm Terry, I'm a nurse, I'm going to take care of everything for you. I'm going to figure out who you need to see when and just take care of it.
And that was my next question. You said, I'm Terry, I'm a nurse. So why is that word when it's a nurse navigator versus someone who might not have that nursing background?
Yeah. So, when we started navigation, before we had navigation at the Cancer Center, I've actually worked at the Cancer Center before we had navigation, and we had new patient schedulers that would connect to new patients, and they'd have an algorithm that they would follow, and the patient would say, I have liver cancer, and they'd look, who sees liver cancer in our cancer center? Well, maybe it was actually breast cancer that spread to the liver, or maybe it was lung cancer that spread to the liver, or maybe the surgeon isn't the next step for them. Maybe they need a different type of doctor first. And so we tried to build algorithms in the computer to guide them, and it's impossible because cancer is so complex, and every patient is unique. Every patient is different, that the computer couldn't possibly capture all of the different ways that a patient would present. So then we know if we put an expert nurse who's part of that multidisciplinary team of providers, and that they know the right next question to ask.
Yeah, these are the experts.
And these are the experts.
Here we go, Rhonda and Sarah. And I know last time that Jason and Rhonda were on the program, we had a fun little surprise. We're going to show you the clip here in just a second. But Jason, just kind of explain from that patient's perspective what it was like when you first heard Rhonda on the phone. And I have to say, when you and I first spoke about you coming on the show originally, Rhonda was the very first person. You said there was this woman that just was everything to me. And it was like, well, who's this one? A doctor? Is it? Well, who is it? You're like, no, it was the nurse navigator on the other end of the phone that helped me lay everything out.
Yeah, I was the best way to say it is I was a little dinghy in the ocean, and Rhonda was my lighthouse. And everything's chaotic in that first diagnosis, and adrenaline is going. You're really trying to figure out how to move and what you're going to do. And I use KU as my primary for my medical provider, and I had called KU Cancer Center, and I was immediately connected with this amazing person. And that was the first thing, is that she's like, "Hi, I'm Rhonda, and I'm a nurse, and I'm going to help you." And I needed to hear that. And that's something that, as a firefighter, we do that with our patients. But being on the receiving end, it was unbelievable.
Well, yeah. Okay. So you don't usually meet people, Rhonda. You see them and you're kind of engaged with them for the first couple of weeks, and then they're off onto their journey to getting better. But the last time we were on, we had this little fun surprise where I was like, how am I going to find this Rhonda? I was making calls and sending emails, like, I got to find Rhonda because Jason's coming on. So here's their first face-to-face meeting.
She was able to read me quickly through my tone of voice, and but she calmed me down. Yeah.
She was a part of kind of your mental. She helped with that mental state.
Absolutely.
You'd never met her before, right?
No.
Okay. Well, that's about to change. We tracked down Rhonda.
Are you kidding me? Hi. Thank you so much.
Oh, you bet. Nice to meet you.
I mean it.
That was like my daytime talk show moment where you had the surprise guest that comes out. So there it was, and I loved it. It was so great to have you guys meet. And you said, Rhonda, it's kind of rare for you to interact. So to know that, months later, Jason was talking about you and wanting to meet you. What was it like? What's it like to know that you impact people the way you do?
Oh, it was just such an honor. It was such an honor to get to meet, because like you said, most of we do over the phone, and so, but it was just an honor.
Well, it was really special for me, and what you do, and it's always amazing about you don't know who's on the other end of that phone and what their experiences are, but I needed that, and you guided me through the toughest time. I mean, you had all my appointments ready to go. And I had that MyChart app.
You said how many appointments did you already have lined up?
I think when it was all said and done, I probably had over 22 appointments through the duration. But she put, I think, the first 10 or 15 appointments. It was automatically loaded, so it was seamless for me to go to my calendar and to know that it was there, and to have that foundation set in place, because I'm trying to speak to this with no knowledge of what I'm going to do, and then explain it to my support system so that they can get set.
Exactly, because you've got to then report back, and you're going. It's all going through your head as it is. Rhonda, what's it like though, knowing that when you pick up that phone, you're talking to somebody who has just received one of the most devastating pieces of news they've ever heard. They're very confused. They're scared. They just want answers, and you're the one.
Yes, yeah. Well, you just try to remain calm and just let them share their story. Where have you been? What has done? How'd you find out about it? And you're putting a timeline together. And just listening is the biggest thing, and then pulling it all together.
And who would have thought? Jason's the one who shows up and tells everybody to be calm, and he's the calmer on the scene. You've said, I show up at all sorts of catastrophic events, and I'm there to be the calming voice, and it was not the case in this time.
Not at all. Yeah, different kind of panic.
Different type of panic. So nurse navigators, they're typically focused on a certain type of disease. So Rhonda, you handle head and neck cancers, including Jason's oral cancer, as we mentioned, but why are nurse navigators specialized in just certain types? Why is it important that it's specialized?
Yes, I think because with that just advanced knowledge and in-depth care of that disease group, you need that for the coordination of the care, and it just develops confidence and for the patient to determine, what treatment options are, and just to coordinate the care appropriately.
And patients don't get to see this behind the scenes collaboration, but there's something called the tumor board where doctors meet to discuss new cases. So what's going on inside that meeting? And again, letting patients know that there's a bunch of people gathering to talk about you.
Yep. A tumor board is really a meeting that takes place with a bunch of different doctors that are involved in a type of certain cancer. So we have breast tumor conferences, we have GI tumor conferences, head and neck tumor conferences. And in this conference, excuse me, we have medical oncologists, surgeons, radiation oncologists, pathologists, who are the doctors that actually look at the tissue and diagnose the tissue under a microscope. We have radiologists who put the pictures of the cancer up on the screen, and everybody can look at it together. And the nurse navigator is a big part of that conference. And what our role is when a provider wants to present their patient at the conference, they let the navigators know, so we can make sure that everything is available for the physicians to have a meaningful discussion about the patient. And then we attend the conference, we document the outcome of the conference, whatever is recommended for that patient, whether it's additional imaging, a biopsy, or here's the treatment that all of us put our heads together to come up with a plan for this patient. And then we carry through. We make sure that whatever is recommended actually gets communicated to the right people to carry out the plan.
So Sarah, you're devoted to a specific type of treatment called proton radiation therapy. We talk about that a lot here on our program. What's different about the area in which you work in, and why is it so specific?
Yeah, so I primarily navigate pediatric patients that need radiation. Any child that needs radiation comes to KU for that care. But just like we've discussed, it's multimodality. So while they need radiation, they still need to be working with their oncologist, they need to be working with their surgeon, and many other providers that are outside of KU. So it's a large collaboration, and I serve as kind of the bridge between all those doctors to make sure that the nurse here that's caring for them daily understands that everything is still being collaborated and cared for. I get to meet them at consult so I can introduce them to their care team and help them understand how the process works. Because it's really overwhelming to families to learn our next step is radiation, and we have to go somewhere else. So to be that kind of extra help, and then to make sure when radiation is complete that they get a transition, a very safe transition back so everybody understands how the care goes from there. So a lot of ongoing collaboration, and really that's why it ends up being one navigator for just that radiation component.
And with cancer diagnosis, I mean, time is of the essence in most cases, and there can be barriers that can keep you away from really important, timely care. How do you try to eliminate those barriers, Sarah?
A really big step of nurse navigation is trying to identify those barriers. And sometimes the hardest part is our patients don't know their barriers at time of diagnosis, because kind of like Jason was saying, you're overwhelmed. You're kind of frozen a little bit. And so a lot of it is, getting that story, trying to understand, what does their life look like outside of this cancer diagnosis, so we can understand how to keep, all the pieces together. I have with working with kids, a big barrier I see is these parents are trying to maintain everything. They're trying to maintain a home, a job, other children, and not even a superhero can pull that off. And so just trying to find them all the resources needed. We have amazing social workers. We have great financial advisors. And so just keeping them tied in. And I like to remind families and patients, you might not know day one, because at consult you've learned a lot, you've had a lot of discussions. The important part is when we check back in, our social work checks in maybe week 2 or week 3, when they see what their life is going to entail on treatment, and just continuing to provide resources and support.
I love hearing that, because as a parent, you want to lock up the house, quit the job, and I just want to be bedside with my kid, and I don't want to worry about anything else. Which then kind of brings me to a conversation that I'm sure a lot of people, parents, caregivers think about, which is, how am I going to pay for this? That's the first thing that I would wonder would come to someone's mind, as I have this major financial burden now, but my health needs to come first. So how do you help clear those burdens?
Yeah, you know, we have, like Sarah mentioned, financial advisors in the health system that help make sure that people can maximize on their insurance, or if they don't have insurance, they can help sign them up for insurance, which is really, really important. And then our social work team is also hand in hand with that. There are different charity organizations out there that can be identified to help pay those bills. Like, even if you have great insurance, you can still, you know, this is an extremely costly medication. So the Navigator's job is to figure out who needs this help. Like, do you have any concerns about where you're going to get your next meal? Have you had any problems with paying for your prescriptions? And then when I identify a patient, then I can connect them to all these valuable resources that we have in the health system.
And like you said, maybe things that they forget to tell you in those first moments because they're thinking of something completely different. So you're always thinking several steps down the road. So we have more questions for our guests, and if you have questions, we will answer those in just a moment. You can use the chat on YouTube or Facebook, or email the Medical News Network. The information is right there on your screen. So we love to show this off. Take a look at these really cool, beautiful masks. Sarah spends her free time, yes, her free time, crafting these works of art. They really are a work of art. And these go to the children who come in for proton therapy. So Sarah, explain what the masks are, kind of underneath the art. What is the purpose of these masks?
So any of our children getting irradiation to the head, neck area, we need to have a way to safely keep them in the same position every day, from the day we started planning to every day when they come back for treatment. So we use this mask as an immobilization device. So when they're laying on that table, it secures them in the same position every day. And so when we make those masks, it can be really overwhelming to patients because it starts as warm and wet, and then we have to stretch it over their face to make their exact mold.
I cannot imagine.
It's tough. We have great child life. We dance, we coach through them. And we do there's a lot of silly things that happen behind the scenes to just break the ice on these. So one thing, and I'm always looking for ways to individualize care for patients. And so one thing is giving these kids a decision, and hey, what do you want your mask to look like? They don't get many decisions once they've been diagnosed. They lose some independence. So we talk about, what do you want your mask to look like? And a lot of times, excuse me, what they choose, it ends up being a theme through their treatment of like how to motivate them, how to get them coming back every day. And so it's my favorite part.
What are some of the fun themes that they've picked out, and what have been the reactions of the parents when they?
We've had some crazy ones. The hardest one I think it did was a SpongeBob pineapple under the sea, like the actual house that SpongeBob lived in. As you can see, like those masks are porous, and so they're not the greatest canvas. And so sometimes when they're like, "Ooh, I want it to look like my own personal dog," I'm like, "Oh, yeah, okay, we're gonna do that."
You asked, so you got to be up for the challenge.
And I made it happen. It was lots of cotton ball and super glue, and it was all stuck to my hands. And so, but it's a big range. We get a lot of sports ones. They have a lot of heroes. Like Patrick Mahomes, or that these kids look up to. And I think for them to see how strong they are and compare it to how strong they are during treatment is a huge motivator for kids.
You take on a lot as a nurse navigator. How does that help you with your emotional state throughout watching these kids go through this tough time?
I think that it helps me. I want them always to know how cared they are. I think at the end of the day, I want to remind them that you're more than a patient. And I tell parents too, like, remember to let them be kids too. Like, I know that you're worried and you're scared and you want to keep them in this bubble, but let them be kids. And so I think it's one way for me just to be able to, like I said, personalize my care. I can't change the diagnosis, but if I can make an impact because they finally got a decision or they got to do something personal, that's huge to me. I always want them to know how much I care.
Well, and I know it's hard to be emotional in front of parents and kids, so I'm glad you could come here and show your emotion, because I kind of release that out with all the work you're doing behind the scenes at the hospital and obviously at home with your works of art. So we know how important the nurse navigators are at the beginning of the treatment process, but what about after? Jason's 5 years out now, so Rhonda, any reason why you would ever come in contact with Jason again? What's the survivorship? Who hands that off? When it comes to a patient like Jason?
Well, we remain a resource, and then we have other programs. I'll let Terry kind of talk about that too.
We actually have a dedicated role, a navigator role for survivors, and Kyla Alsman is our transitions to survivorship navigator, and she starts with kids at Children's Mercy who are being treated for a childhood malignancy, and They are in a survive and thrive clinic now that they've been cured from this cancer, but they still need lots of follow-up. And then she's literally the bridge from children's to our adult clinic, survivorship clinic here that Dr. Becky Lowry runs.
Yeah.
And so her whole role is to help improve life for survivors. And I would just say that the Navigators, they're intensively navigating patients at that beginning. And then we have a whole team of nurses at the Cancer Center that help take care of patients. We have coordinators that do that day-to-day treatment coordination while a patient's going through their treatment. And the treatment nurses themselves that are giving the infusions and radiation and whatnot. So it really takes a whole team to take care of the patient.
And it takes a patient to be really vulnerable. Jason, big, strong, studly firefighter. You heard it here first. But you really have to kind of just hand it over to other people, and you just kind of got to let go and go, you got me, and go with it.
I think that's the hardest part is the quick trust that has to be in the rapport that was built. It made it so that it was seamless in the transition with my other nurses, and that was really special because I got I think 2 or 3 follow-ups after my first call, and it was just those check-ins to make sure that the other people on the other end that I was going to hand it off to, they were going to be there for me, and then I could share my success, because every time you're hitting all these plateaus of either doing imagery, if you have to go in and pre-consultations, a lot of pre-consultations, and then, you're hearing words that you really probably have never heard for the first time. And then, of course, worst thing you can do is you go to the internet and you're looking everything up, right? And so I think that was the one thing that with Rhonda, she was really quick to say, put your faith in us, and and allow us to inform you on what's going on. And receiving the packet in the mail, and when I say in the mail, it was like it was FedEx to my door the next day, and it was immediately like, hey, we've got you. And I was like, wow. Yeah.
Another wow moment. Tell us about your meeting on the streets.
I had a special moment about a week after we did the show here, and I had a stranger on the streets stop me and said, hey, I saw you on the KU channel, and I was like, who are you, and what are you stopping me for? And as we started having this amazing exchange and started talking, he informed me who he was, and I prodded him a little bit, and he finally broke down, and he explained to me that he was Tom Walsh, and his wife Teresa and he are the reason why the navigation program exists. And I asked him, can I give you a hug? And I gave him a big old hug, and I thanked him because he's part of that team that helped save my life. I mean, this past week I got to watch my son graduate, get his diploma. So, those are all those things that you hope you're going to be able to have, and 5 years later. But the Walsh family, very special people in my heart for taking the moment to selflessly donate money to get this started, and all the lives that they affected, and then how many navigators it's grown to.
Yeah, we have over 30 cancer navigators.
So amazing.
Well, to think that people have struggled with this over the years, and then the Walshes go, wait a second.
Yeah.
I got an idea. I mean, how important is that for somebody to come up with an idea, to notice there's kind of a kink in the system here?
Yep.
And to make sure that people like
So
Jason
special.
get to graduations.
Yeah, I'm grateful.
So exciting.
words.
So exciting.
Yeah,
so,
thank you.
Talk about the mental health side of things. Jason, did you find the need, feel the need to seek some mental health?
I did, yeah. Great question. It's one of those things is, for firefighters, we're fortunately, we've got a really good mental health system in my fire department in Kansas City, and so we have a program called 42 Cares, and they had just started in their initiation of that, and it was really great that I could lean into my peers, and they helped me get counselors ready for me. And if I needed one, they told me where I could go to get it, and to be able to get therapy. And I did. After the treatment, you're going in and you're like, okay, now what's my social identity? Mm-hmm. And because a lot of us are so affected by work or family and so forth, and you're learning to maneuver differently, and taking the moment to talk to somebody to kind of give you the tools. That was really essential for me.
And is that a question nurse navigators ask? How are we doing mentally? Because that kind of feels like it starts almost with that.
Yes.
Yeah, I mean, I say how are you coping with all this? You know, you've been going through a lot here, and that can open the door, and sometimes people are like, I just want to know where to park when I get to my appointment. And others are like, I'm not coping well. I don't know how to tell my family. I have all of these situations. So we have oncopsychologists that are part of our team as well that we can help pull in to when needed to help patients too.
Let's get to some questions from our viewers this morning. And Marsha wants to know, Terry, you mentioned that there's a nurse navigator for transition to survivorship for children. Is there anything like that for adults who are leaving the routine of treatment and all of their appointments, transitioning back to life after treatment?
That's an area that we really want to focus in on in the coming years. We understand that, people are living longer with cancer, and our primary care doctors are needing help with managing all the survivorship needs, and I really do think that we could see a future role with adults in navigation.
Carrie wants to know what's the difference between a nurse navigator and a case manager?
Sure. Very similar roles, and honestly, when we started nurse navigation at KU, I initially looked for people that had a lot of oncology experience, because you do have to have that expertise. But then I realized if you've got that case management where you can really pull that picture together, pull that whole story together, know how to juggle all these moving parts at once, that you can also do this job too. So I think in our case management department, a lot of times they don't always have to be nurses. It can also be a social worker that is in a case manager role. But in the navigator role, you're really with just, you're hyper focused on one particular area of cancer that you're there to help with.
Angie wants to know, what was your specialty in nursing before you became a specialist in nurse navigation to our nurses?
Yeah, well, gosh, I've done a kind of a wide variety, but a liver transplant prior to going to nurse navigation. So I got exposure to cancer there with liver cancer, and that just kind of drove me into going to oncology navigation.
Transplantation.
Yes.
Wow. Sarah, what about you?
I've always done peds oncology. I did inpatient peds oncology, and then phase 1, phase 2 clinical trials, kind of building a program at Children's Mercy for that, experimental therapeutics. And then, it's just always been peds oncology. They have my heart.
They have your heart. I think they do for life. Terry, what about you?
Yeah, same. I've only ever done oncology in 30 years of nursing, and all different types of oncology nursing. But the navigator role is really, the highlight of my career.
I bet, really. Yeah, that's good. That's great to hear. Is there navigators outside of oncology? Or?
Yes, we actually have 7 cardiology navigators. When we started that, the vice president reached out to me and said, we've got some really sick patients over here that have chronic complex needs, and I like what you did with cancer, and could we do the same thing in cardiology?
Over there across the street. They're like, come over here and show us what you're doing. Well, that's good. We know that it's spanning out across all types of patient care. Jean just has a comment. Great program. Navigators are so important during this really confusing time in these situations. So your work is noticed. Please know that. I want to get our takeaways. And Jason, I'm going to start with you. What's the big takeaway? What do you want people to know?
Call. That's all I can tell you. Call. Pick up that phone. Take the moment for yourself. And I think the big thing for in this strategy of trying to get better, knowing that you don't have to be alone. You'll never be alone. There's always somebody there for you here.
There's always a Rhonda.
There is.
Rhonda, what's the big takeaway?
Yeah, just that we have a designated group of caring individuals, navigators, and we're here for you, and we're going to move the path forward for you and get you teed up and taken care of.
Sarah?
I always encourage family, keep asking questions. I want them to feel confident in all their treatment decisions, their day-to-day, and so I always remind them, keep my contact information, because your questions might come, a little bit later on, and I don't want you to think, Sarah's gone, okay, I'll figure it out. No, always keep asking questions and reach out.
Okay. Terry, what's the takeaway?
And I think what Sarah said, the navigator is so important at that beginning stages to get the patient, on the right path. But then it really is a whole team of nurses and providers that come together to really support the patients all the way through.
Good. Thank you, ladies. Thank you for all you do and for being with us. Jason, come back anytime. Like I say, you're like a frequent flyer.
Thank you all. I mean it. Thank you.
Yeah, thank you. I know you've shown your gratitude, and we're glad to have you with us. Thank you. Thanks to all of our guests. Thanks to our viewers for being with us today. We'll have a great weekend. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update. Bullets leave scars, both physical and emotional. I'm Jessica Lovell on the next Morning Medical Update, the public health approach to gun violence. Hear what a trauma surgeon sees on an all too frequent basis, plus the program that supports victims while they're still in the hospital, Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.